The knee-jerk reaction for years has always been those who struggled with addiction, you did a strictly punitive effort, and that reflects a complete misunderstanding of the problem of addiction. Certainly, what I've heard in hearings I've held all over the state of Vermont. And we're abandoning these decades-old misconceptions and prejudices how to confront addiction. Of course, law enforcement has an important role. And I've worked to include in this bill an authorization for federal funding to expand state-led anti-heroin task forces. But importantly, CARA combats addiction as we would any other disease. Evidence-based prevention, treatment, and recovery program. What I found, and I'll just use one example, the city of Rutland, where I found a couple of hearings. We had to enlarge the venue we were going to do it because so many people wanted to come. We had law enforcement, the faith community, educators, medical personnel, parents of addicts and addicts. And we realized everybody's in it together. And went across all political, social, economic strata. Now, we know that there's a particular impact on rural communities because of opioid abuse. I'm glad the manager's amendment includes my provision to support our rural communities with an overdose reversal drug, naloxone. Rural America has been hit hard by addiction. Emergency medical services can be limited. This chart shows not only the death rates from opioid overdoses steadily climbed across the country, but there's a real disparity between rural communities and major cities. And I look, Senator Cornyn, Senator Grassley, you both have a lot of rural communities as well as big urban ones, as we all do. And I think we have to look at that. The more rural location, the higher the death rate. The highest rates include small town rural, places like Bennington, Rutland counties in Vermont, and very rural places like Lamoille and Essex County. Essex County is in an area that we call the Northeast Kingdom. Both my mother and my wife were born there. If we get naloxone into more hands, we'll save lives across the country. Now, we're not going to end addiction just by a bill. We have to work a lot harder to remove obsolete barriers to effective treatment, to find safer alternatives to easily abuse opioids for everyday pain management. We need a significant commitment of targeted resources. I co-sponsored Senator Shaheen's $600 million emergency supplemental appropriations. You know, we passed larger bills to address swine flu and Ebola, even though we did not have Ebola in the United States. This we do have in the United States, and every community does. So I hope we can get all of these methods, and I think the hearing, Mr. Chairman, you held the other day was extremely important.